Let us have a quick discussion on a small pediatric topic today. So the topic for today is epistaxis in children. So epistaxis is bleeding from nose. So what is the most common cause of bleeding from nose in children? So the most common cause is idiopathic, also known as primary cause. There can be secondary causes as well. So what are the secondary causes? So in secondary causes, the most common is nose pricking. So in secondary causes, the cause can be local and small, such as trivial trauma, or it can be a sequelae to a systemic disease like thrombocytopenia, any coagulopathy, von Willebrand disease, etc. Now, what is the most common site of epistaxis in children? So the most common site of epistaxis in children is Kieselbeck's plexus, also known as Little's area. It is located at the anterior part of the nasal septum. What it is made up of? So it is made up of mainly 5 arteries branched from the anterior ethmoid artery, from posterior ethmoid artery, from sphenopalatine artery. Sphenopalatine artery is also known as the artery of epistaxis. Then there are 2 arteries which come from bottom, that are superior labial artery and greater palatine artery. Now there is something called as severe recurrent epistaxis. So remember 5 causes of severe recurrent epistaxis. They are thrombocytopenia, when the platelet is less than 50,000, then coagulopathies, von Willebrand disease, HHT. What is HHT? HHT is hereditary hemorrhagic telangiectasia, and the 5th one is hemangioma. Now there is something called as juvenile nasopharyngeal angiofibroma. So whenever adolescent boy come with complaint of severe unilateral epistaxis, then you have to think about juvenile nasopharyngeal angiofibroma. What is it? It is a tumor, and the most common age of presentation is adolescent age group, and it is a tumor which is dependent on testosterone and androgen levels. So whenever an adolescent boy came with complaint of severe unilateral epistaxis, you have to think about this. Now let us have a quick discussion about the management of epistaxis. So how will you manage a case of epistaxis? So most of the cases resolve spontaneously and nothing is required, but the cases which do not resolve spontaneously, there is a line of management. So the first step is digital pressure. So what is digital pressure? You have to pinch the nose, the anterior part of the nose, with the help of a thumb and the index finger, and let the child sit in upright position or lean forward. Do not let the child lie down, because if you let the child to lie down, then a part of bleed will go backside, and it will irritate the throat, and also you will not be able to document the exact amount of bleeding. So please don't let the child lie down. And the second thing you can do is cold compression. Cold compression you can do with the help of ice packs, but do not put it directly. Just take one thick handkerchief, it should be clean obviously, and just wrap your ice pack in it, and then put the cold compression. Then you can use some nasal drops, local nasal drops like oxymetazoline and xylometazoline or phenylephrine. Then if the bleeding do not stop by that, then you can consider nasal packs, anterior nasal pack, and if the bleeding is severe, you can consider anterior plus posterior nasal pack, and by that time you have to take the help of ENT specialist also. Now the 4th step, if it does not resolve by that also, then the 4th step is surgical management. And for superficial arteries, if the source of bleed is superficial arteries, then cautery can be done, and if deep arteries are involved, embolization can be considered. And this is the role of surgeon.